Good morning. I'm Doug Bridges, Chairman of the Cleveland County Commissioners, and welcome to the second Cleveland County Vaccination Update and Community Forum. I'm here today with Brian Epley, our County Manager, and Tiffany Hanson, our Health Director. We're sitting approximately 6 feet apart. We do have our masks, but in full disclosure, Brian and I have already had COVID, so hopefully we have antibodies. And Tiffany, as a frontline worker, has been vaccinated. But we do wear a mask. I want you to realize that. Things seem to be getting better with our COVID graphs and things. Tiffany, I'm not real good at reading these graphs, but Tiffany's here to explain it all to us. As I understand it, we have 9,500 confirmed cases, and we vaccinated over 7,000 people. So our herd immunity is getting up to about 16%. And as I understand it, we need about 4 times that much to feel safe. But slowly but surely, we're getting there. And just like everybody, to be patient. So much depends on our federal and state government. I talked to Virginia Fox last week. She says they're doing everything they can to get the federal government in line and get them to us. And Tim Moore, of course, is our speaker, who is local, and he's doing everything in his power to get the state. But I think so much depends on us getting the vaccinations, because our health department is really working to take care of us. And with that, I'm going to ask Brian to.
Yeah, thanks, Commissioner Bridges. And again, a special thanks to Tiffany for joining us this morning. This is just a continuation of what we started 2 weeks ago, and I apologize too that we're 30 minutes late. We actually began on time at 9 a.m. and had a few technical difficulties, as can be expected. The benefits of technology and the ability to communicate on a platform like this also comes with some unpredictability sometimes. So I apologize. Thanks for being patient with us. We did this 2 weeks ago for the first time, and now just again continuing with that commitment. We'll do it for the foreseeable future, as long as it proves to be helpful as a way, again, to keep folks updated, to allow our citizens to ask questions and give us feedback. We're also looking for constructive feedback. We know that there is no playbook for what we're maneuvering through. One of the biggest things that we hope to accomplish this morning, and Tiffany will take over momentarily, is to give you, from a data and a statistical perspective, how our local community is doing, and then also update you on some changes that have happened since the last time we were able to connect. The one consistent truth, as we've navigated not only for the last 10 or 11 months through COVID, but more specifically in the last 45 to 60 days through the vaccination process, is change is imminent, it's fluid, and it's really challenging sometimes. And so we want to share everything that we know with you guys, and then obviously provide a little bit of time at the end to ask questions and get some of your feedback and maybe some things that will help us be better. So I'm going to ask Tiffany now to take over. And again, I just want to welcome you and thank you for your time this morning and patience as we try to get some of this information out.
As Brian and Commissioner Bridges indicated, I'm going to give a COVID-19 vaccine update, and we'll start with our Cleveland County local data. So as of today, we have 9,502 total confirmed cases of COVID-19 in Cleveland County. We have around 315 of those cases that are active cases, so 3.3%. We unfortunately have 196 deaths, so around 2.1%. And we have 8,991 cases that have recovered, so 94.6%. You'll see the state actually modified their graphic last week. This one isn't quite as easy to read, but one thing, as Commissioner Bridges indicated, that we can take away from this is that we are seeing a decrease in the number of cases since, shortly after the holidays. Now we're starting to see a decline. So I think that is an important takeaway, as well as just a reminder to continue to be vigilant and be aware. One thing that we get a number of questions about is really the decision making and who has control to make decisions at what levels. And so this image is really good. The first one is our manufacturers. So these are the Pfizers and the Modernas. They are really focused on production and increasing their production numbers. The next level of the decision-making chart is the U.S. federal government. So they are the sole contractors with the manufacturers, and they determine our state allocations. North Carolina Department of Health and Human Services then is the next layer here, and they determine who receives and where, and the number of doses that each county is going to receive. And then you'll see on the local level, Cleveland County really has decision about the giving of the vaccines and how that's going to look. The next image is the WHO's, and so this is really the state framework that was updated January 14th, and we haven't seen a whole bunch of modification to this, although yesterday North Carolina DHHS did remove the framework from their website, so we're not sure if that's going to give any indication to any upcoming changes. But as of today, this is the most recent framework with the update only to Group 1, which then provides now further eligibility to home caregivers, to medically fragile children and adults providing routine medical care. So those folks are now eligible under Group 1. Here's our vaccination timeline. If you recall, in early December, North Carolina started receiving vaccinations. Our framework really was focused on healthcare, first responders, and then chronic diseases. Cleveland County started receiving our first and second dose shipments. The framework then was shifted to focus on healthcare, first responders, and those individuals 75 years and older. We then received our third shipment. The state shifted our framework again to healthcare, first responders, and those 65 and older. This actually is when I started talking about how the state was determining our allocations based on performance. So if we administered more vaccine, we were going to receive more vaccine. Cleveland County then was fortunate to be able to partner with Atrium and get 2,000 doses that week, along with our regular allocation. And then last week, the state shifted our distribution model to be focused only on population. So over the last 45 days, we've seen 5 changes to our vaccination framework or timelines. As I indicated, 119, the shift for our dose allocations changed to be solely based on our population. The state of North Carolina receives 127,000 vaccines per week. 84,000 of those doses are allocated to local public health departments across the 100 counties. Cleveland County is set to receive 700 doses over the next 3 weeks, which we know is significantly under our capacity of 2,500 doses a week. A couple significant changes that we've made because of the shortage and the low dose numbers. So since we're only getting 700, as far as our capacity, we know that we no longer need 2 or multiple methods of communication. So we're going to be transitioning to structured phone appointments at consistent times. So those are going to be every Friday from 1 p.m. until appointments are filled. That number that's going to be utilized for vaccine scheduling is 980-484-6019. We will still continue to do pop-up vaccination clinics as doses allow from partners such as Atrium, but we know that those are extremely limited as well. And the largest takeaway with the communication model is really the no U.S. postal letters, because just based on our capacity and the number of doses we're getting, we no longer need to utilize the multiple methods, as well as our engagement rate with the U.S. postal letters remains very low, around 50 or 60%. The second takeaway for changes is our vaccination location. Due to only getting the 700 doses a week, we realized that for efficiency of practices and streamline of communication, having a fixed location for both primary and booster doses at the Cleveland County Fairgrounds is the best practice. A couple great, wonderful things that's happening. So North Carolina, although they get 127,000 doses a week, they are taking 41,000 of those doses for community vaccination events or mega sites, such as what happened at the Motor Speedway or Bank of America. Communities can apply for one-time dose allocations if they can demonstrate interagency collaboration, targeting our historically marginalized communities, and really just a good community marketing campaign. Applications opened up this week, and so we're intending to apply in partnership with Atrium Health, Garner Webb, the Healthcare Foundation, as well as our county faith leaders. We'll be applying for 6,000 one-time doses, and those would be delivered to any eligible recipient based on the vaccination framework. So when, you've seen this image several times, so January 2021, we are to be in Group 1 and 2, largely dependent on our vaccine allocations. We're hoping to be to Group 3 by March, to Group 4 in April, and to Group 5 by May, but all of these are completely dependent on the vaccines that we get allocated from the state. One thing to keep in mind is we may not be completely through a previous group before we move on to the next. NCDHHS actually dictates when we move to the next group, so we may not be completely finished with the prior group. Inventory management. So our COVID-19 vaccines to date, including this week's allocation, Cleveland County Health Department has received 5,300 doses. We've administered 4,550, which is about 88%. We had 700 appointments scheduled for this week. So by the end of today, we'll have administered 99% of all of the vaccine that we've been given. A couple things to keep in mind here is really, these are 2-dose series, so we want people to come back and return for their second doses. It's very important. First dose efficacy is approximately around 50 to 60%. And then once you get that second dose, it's when it goes up to that 94.5% protection. So we really want folks to come in and get that second dose. It takes about 7 to 14 days to develop full immunity. So also keep that in mind that once you get your first dose, it does take a little bit of time to develop those immune responses. And any questions?
So thanks, Tiffany. And before we jump into questions, I'll just circle back what she was saying there on the last slide, that we've been unfortunately seeing a fairly low return rate for folks that are scheduled to receive their second dose. As we mentioned 2 weeks ago on the call, there's a plus or minus 4-day, well, 10 to 10-day window approximately in order to capitalize on that second dose booster. It's critically important, though, to enable to accomplish full immunity, that folks that not only get the first dose, they should be given a vaccination card at that time. And it's really, really important that they circle back and get that second dose, or they simply cannot accomplish full immunity. And also, it's not instant after you receive a shot. I know that there's I've talked to folks who believe, well, I have my vaccination, so now I'm safe. There's a window, as Tiffany mentioned, that is required for the vaccination to begin to provide that immunity. It's somewhere between 7 to 10 days, if I recall. And as Tiffany mentioned, the first dose gives you 50 to 60, and then the second dose can get you up to that 94.5, 95% rate. So that's really important. And then again, taking questions here momentarily, but just 3 other points that I really want to make really clear. And the first one is that COVID-19 continues to be specifically in the area of vaccinations, this organization's top priority. We are continuing to serve our citizens at a full service capacity. All of our operational departments are still here to meet the needs. And we're running Cleveland County as we always have. On top of that, COVID is something that we're trying to navigate through. On any given day, you may have 18 to 19 departments that are not only doing their normal job, but also making the sacrifice to try to put a material amount of their day and their effort and their energy and their resources into helping the team navigate through COVID. So again, just to understand and know that this is our top priority. The second thing that I would point out is we want more doses locally. We're asking for them. We had designed a capacity plan that we thought, once we were told by the state that would lead to more doses landing in Cleveland County, we tried to manage to that formula, manage to that policy from the North Carolina Department of Health and Human Services. Unfortunately, that's changed, and now we've been told that we're going to receive about 700 doses per week for the foreseeable future. But I just want everyone that's on the call, and as you communicate with your neighbors and friends, we want more doses locally. We're prepared for them. We have systems and processes to get them out as quickly as we possibly can. As you can see on the screen on the slide, on this slide here, 99% of what we received, we've gotten out to this point. And I hope that it's indicative of the fact that the mega site allocation that the state is using, literally the day that the application process was opened, we applied. We're trying to put Cleveland County at the top of the list, trying to put Cleveland County citizens at the front of the line. You know, again, it's just important that everyone recognizes we want them here locally, and we're prepared to get those vaccines administered. And then the third point I would make before we take questions, I know that it has to be incredibly frustrating just to get a busy tone when you dial the number for vaccines. There's still a lot of folks that are eligible, that are deserving, and that need a vaccine in Cleveland County. And we want nothing more than to get that done as quickly as possible. We know that between group 1 and group 2, which are the two groups that we're able to vaccinate at this point, that we've got somewhere in 24,000 eligible recipients. And to put it in perspective, last week we had 700 weekly allocations plus some additional allocations from Atrium. So we had a total of about 1,280 appointments that we were able to take this week. In the first hour of opening our phone lines, and we have 10 dedicated phone lines just to scheduling appointments, we had 17,000 incoming calls. So that's 17,000 people who are attempting to dial through to get to 1,280 available vaccines. And again, I recognize the level of frustration of getting a busy tone, not getting through. And I just want to encourage us all to recognize that we're going to get through this together. We can eradicate and beat COVID-19 at a local level, and that if we're patient together, that's what's going to be best for everyone. But we're aware, and if there's ways to improve that, we're certainly willing and want to hear from you. So I'm going to pause there, make sure anything from Commissioner Bridges or Tiffany before we start taking a few questions.
No, I'd just like to say that, you know, the county's doing all they can do. And even on the state and federal level, we just need more vaccines because we know we can.
Yes, sir. Now, do we have any questions?
Just a couple, and I think you touched on this, Tiffany, but will you finish group 1 and 2 before you move to group 3?
So North Carolina DHHS actually is kind of guiding when we transition to the different groups. So there is no guarantee that we would be completely finished with groups 1 and 2 before we would move on to group 3.
Okay. I'm a caregiver for my son who has many underlying health conditions. Do I qualify for a vaccine?
So if you're a home caregiver for a medically fragile adult or child, and you are their predominant caregiver, then yes, you would qualify under group 1.
Does the county offer transportation for those who cannot get to vaccine sites?
So that's a good question, and I think that's something that's been really talked about in a variety of ways over the last maybe 2 to 3 weeks. And so we've been not only conducting this forum on Fridays, every other Thursday, we've been conducting a call and a Zoom call with local faith leaders, sometimes between 40 and 50 pastors on that call, recognizing the high level of trust and the broad reach that those folks have. So there's a variety of transportation initiatives that we've talked about. The first one and the most practical one, I believe, is communication inside of those churches, to have small groups commute, especially citizens who may have transportation challenges, commute to vaccination sites as their appointments arise. And we've communicated again with those pastors on how those mechanics could work and why that is such a value add. We're also working through the Carolina Healthcare Foundation and their board to partner with TAC, which is the Transportation Authority of Cleveland County. And we are essentially taking lists, or taking names of folks as they get through to make an appointment, if they have transportation challenges, and then trying to work in a very targeted way with that limited number of folks that have those. So it's kind of on a case-by-case basis, but we recognize mobility is a challenge, especially with some of our group 2 folks who are above the age of 65. And so 2-prong approach. One is first, are they in a church and can the church help? And then the second would be this kind of rolling ledger and a partnership with TAC. I hope that answers that question.
How would they get on that list?
So traditionally, or historically, I guess over the past few weeks, they called our COVID helpline. So that's the 980-484-5316 phone number, and let them know that you would have needs for transportation, and then we'll work to coordinate situationally how that would happen. Yes.
How are you reaching out to underserved communities? Have you reached out to low-income seniors at Lions Village, West Warren Village, or other low-income seniors?
So for seniors, we actually have reached out to a number of either group homes or residential care homes. The health departments across the state actually were shared a list of potential long-term care group homes that did not participate in the federal pharmacy program. And so we at the health department then have been targeting those homes individually. We would encourage folks, if they still are able to call and make an appointment to get to the fairgrounds, to utilize the 6019 phone number and do that. If there are transportation limitations, also continue to call the 5316 phone number. We can talk through situationally those that are eligible.
What about group 1 that is still waiting to get an appointment? How do they do that?
So if you are a Group 1 eligible recipient, similar type of response, you call our 980-484-5316 phone number. Our wonderful helpline people, they will ask you numerous questions about kind of what you do and how you qualify under Group 1. And then they'll enter you into a form that we keep, kind of a rolling spreadsheet. And then as we have dose allocations available, we'll reach out to you, contact you, and schedule appointments.
2 more questions. What is the wait time at the vaccination sites? Once you get there, how long does it typically take?
So we're seeing about a 40-minute wait time, which includes the 15-minute observation time. And so, plan for about 45 minutes start to finish.
The last question on here right now is, has the state prioritized any subgroups within Group 3?
This North Carolina Department of Health and Human Services have not prioritized any groups within Group 3 at this point.
And just to be clear, as Tiffany mentioned, we have no insight as to what this means. Maybe we're reading into something that is not indicative of things to come, or maybe it is. But as of yesterday, the state completely removed the framework from their website, whether that's a pro forma of something to change or whether that's routine maintenance. We're unsure. But aside from not having subgroups, we're not even sure that we have a framework at this point.
That's all we have.
Well, certainly, again, that was helpful, I hope. We'll wait just a few more seconds in closing, make sure there's no other questions to come through. I want to encourage you to share this link, share this forum. We'll be back again in 2 weeks. Hopefully our numbers continue to trend in a positive way. The takeaways that I, again, would just reiterate for clarity and communication purposes is that, as Commissioner Bridges stated, we're somewhere between 15 and 20% of immunity in our community, and a lot of that depends on that volatility is where else have folks been vaccinated, but we know for sure that roughly 16,000 folks have some type of immunity. And so as we track toward herd immunity, just know that things are, at least recently, trending in a better way here in Cleveland County, that we want to get as many vaccines here locally as we possibly can, and communication and patience continue to be the key. And we are so thankful for each of you joining us today. Anything from the group before we sign off?
Well, I'd just like to say, Carrie Melton, the assistant county manager, and I were talking this morning about some of the things that are going on. And we come to the conclusion that Cleveland County is really making a difference. We're partnering with Boys and Girls Club and the YMCA for childcare so that people can work. And actually, there's some programs to help small businesses get through this. And I think it's also important to note that the county's still running. If you need a building permit or an inspection, the health department services, if you need a birth certificate, and maybe most importantly, if you got an emergency, you call 911, everything's still working. And our employees are going out of their way to volunteer to help with these vaccination sites, answering the phones and everything. And we're still running the county as normal. Also, we just all need to stay patient. You need to be patient waiting for the vaccines to get here, and patient as you're trying to get through on the phone lines. Patient in the line. One or two people have said, it took a long time. And then I had somebody else said, well, gosh, 45 minutes it takes me. I wait 45 minutes in the doctor's office waiting for him to come see me. And they thought it was really good. So, and then I think it's important, as has already been said, to make sure you get that second shot. And as always, county commissioners really appreciate all the employees, and we appreciate serving the county.
There's one more question that just came in, if you don't mind answering it. What do you do with leftover doses from the no-shows for appointments?
So at the end of the day, if we have any remaining doses, which we have very few because we schedule each appointment according to the dose allocations that we have, but then those actually go to our group 1 recipients that are on that spreadsheet.
And we call those folks as we have doses available. Is that right?
Yes.
So again, back to the question before, if you believe, for example, an in-home aide or in-home caregiver that recently became eligible, and you call and you go through the questionnaire to qualify, you go on a list, we reach back out to you as doses are available to come in and be vaccinated. So again, thank everybody for your time. We'll talk to you in 2 weeks. Certainly, again, share the link, share this forum with your friends and neighbors, and we're going to get through this together. Take care.
Thank you.